In my personal and professional life, a door closed, but a window opened. And I've been in private practice now for about 9 years. Back then is, can I do this? I spent 17 years as an RN, always relying on a physician. Those are not very conducive to saying, you can do it on your own. I love my patients. Some of them I've been taking care of for my entire career. It's just a lot of fun to love my patients and take good care of them and feel their love and respect back. I'm pretty self-disciplined in that I finish all my charts the same day. I don't let myself go home until they're done because I want to close the book and be done. I just love what I do, and my patients are happy to see me and they support me greatly in the community, and I get word of mouth referrals. I can't even take all those referrals. I think the other important message that I want to deliver to NPs is that physicians have elected to vacate the family practice, independent practice, and I think we need to get in here right now and fill this spot because it is a beautiful spot to be. So let's get in there and take hold of it and keep it for us.
Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. Today's guest is the definition of a disruptor. From the mountains of Flagstaff, Arizona, meet Mary Pasternacki, a nurse practitioner with 28 years of experience who founded Mary Pasternacki Family Healthcare to eliminate the middleman, and the middleman is the doctor, and bring care straight to the people. She opened her doors in 2016 and quickly became a lifeline, especially for the elderly patients in her community who were using the ER as their primary care provider. Her mission? Make healthcare more human, more accessible, and a lot less complicated. This is what it looks like when NPs lead. Let's get into it. Mary, thank you so much for being here. I'm so excited to have you.
Thank you for inviting me. This is very exciting. My first podcast.
That's amazing. That's amazing. Okay, so we're going to ask you a few questions. We're going to get to your practice. Well, no, I lied. Your practice, tell us where your practice is right now.
I live in Flagstaff, Arizona, and I have a practice here that I've been in private practice now for about 9 years.
Amazing. So before we get to what's happening right now in this practice, tell us why you became a nurse practitioner.
Basically, in my personal and professional life, a door closed, but a window opened. And so I stepped through it, and here I am. I'd been a nurse for a long time. They opened up a nurse practitioner program here in the same town. And so I was in the very first nurse practitioner program at Northern Arizona University.
Wait, what was the door that closed, the window that opened? What happened?
You know how it is in healthcare. You're kind of I had a very exciting career, moved from one thing to the next to the next. The thing I did before I went to NP school was I was a flight nurse, and that was a ton of fun. And I thought I'd retire in that career, but then there ended up to be some political things that I just had to keep scooting along and do some other things. And so that's when the nurse practitioner program came along.
Okay, like I know I have to spend time on nurse practitioner, but flight nurse is so cool.
Yeah, it is. It is.
Is it
I thought
helicopters or?
At that point in time, we were doing fixed wing because in Arizona, we fly such huge distances to get to a tertiary care facility that airplanes could actually, in those days, fly faster. Despite the ambulance transport time to the airport on both ends, it could get there faster than a helicopter. It's not unusual to fly 150, 250 miles, 300 miles to tertiary care.
Hold on, this is so fascinating. So this is like you're a nurse and something happens, I guess, in a rural setting, somewhere where it's too far to get some sort of services. Like, give us a description of what type of thing you were called for.
So I live on the edge of the nation's largest Indian reservation, the Navajo Nation. It's also the Hopi Reservation is set within there also. And so there's no level 1 trauma centers there. So everything from the reservation, which is the northeastern corner of Arizona, hundreds of miles, any car accidents, anything that would happen, neonates that need to go to tertiary care, pediatric patients who develop a need to be intubated and ventilated. All of them were moved to facilities either in Flagstaff or primarily in the Phoenix area.
So they would be managed locally and then realize that it'd be recognized that they need escalation in care. They would call your facility and they would throw you on a plane and say, go get this patient.
Exactly.
And you have to make sure that they're stable on the way to the hospital.
Exactly.
Okay,
exactly.
That's super cool.
It was fun. It was a ton of fun. I loved it. I'm kind of an adrenaline junkie.
Yeah, for sure, which explains why you opened up your practice, but we wouldn't get there yet. So then you decided to become an NP of FNP?
Yes.
And then what was your first few jobs before you opened up your own practice? What did you do?
I did my time with a physician, and I stayed with his practice for 14 years. And he was very much of a perfectionist, and he had high expectations. Whoopsie.
I love how you just said, I did my time, like it was a prison sentence. I did my time. I served time.
Well, I did 14 years basically of an internship with this physician, and he was excellent. He knew so much. He was a brilliant, brilliant man, and he mentored me for 14 years. Not only did he teach me about medicine, but I learned from him private practice too.
Oh my God, I love that so much. We need that type of mentorship without question. I love that so much. So then did you go from there straight to your own place, or was there another job after that?
So then I did go to another practice, and it was more of a clinic setting. And it was fine, but I found that I was using the physician less and less. And I knew that they were doing instant tube billing. And I'm like, let's get rid of the middleman. Let's get rid of the doctor.
Yeah. Heck yeah. So then you were like, is that when you were like, I'm going to open up my own spot?
Exactly. I just took a leap of faith one day when the office manager said to me, you can't draw blood after 4 o'clock. And I said, I'm the provider. I get to choose if I draw blood after 4 o'clock or not. And I was like, I'm just getting rid of all the bullshit.
All these restrictions. Oh, so you were like, this patient needs blood. And they were like, no, we're not doing this.
Exactly. It's 4 o'clock. You can't do
it's 4 o'clock. It's too late. Patients don't need anything after 4. Your kidney knows it's after 4. We don't need a CMP. Oh my God, that's so funny. So did you, on the spot you decided? Did you go home after run this by anyone? Tell us the process.
No, I definitely went home and ran it past my husband because...
Was he like, are you crazy?
No, he was like, do what you want to do.
I mean, okay, what's his name?
Stu. S-T-E.
Right, shout out to Stu. That's what I'm talking about, Stu.
Yeah, exactly. He's been very supportive through this whole thing.
That's great. So Stu had to have said, it's one thing to be like, yeah, do what you want. It's another thing to be like, I got you. We'll figure this out financially, because in the beginning, you don't make anything, right? So it's big when you partner. I had a similar situation. It's big when your partner is like, I got your back. Let's do this. That's such a great statement of how much they believe in you.
It is
so much. So did you go and rent what is the space you're in now, the original space?
No, it's not. So originally I contacted a nurse practitioner that I knew that was in her private practice, but her practice was very different than my concept of it. And so basically I rented space and her receptionist, and decided that I definitely needed a separate practice. And that's where this whole concept came to mind. She had a lot of Hispanic patients, and I don't speak Spanish, so I couldn't provide them good care.
Understood. But so when you first tested the water, because not only were you telling your story, but I want to make sure that other people can kind of learn lessons from it. When you first went into this nurse practitioner's office, did you still keep your other job, or did you just went in?
I dove in with both feet first.
Well, at least it wasn't head first.
Exactly.
Okay,
and I have to say, I did one other thing before I even went and talked to this nurse practitioner, because I live in a small town. So it's not like I could go and talk with a physician and say, how's private practice? Tell me about it.
Right.
So I did what any level-headed person would do. I called my veterinarian.
Of course. Of course. Because, the truth is practice, right? So,
right.
And what did he say? What words of wisdom did he give you?
And my veterinarian said, go for it. And I talked to her because she has, they have
I said
clientele.
him. Oh my God, I'm so sexist. Her. Her guy.
Her.
Okay, go ahead.
Yeah. And so, yeah, they have a lot going on that's fairly similar to the healthcare model.
Absolutely.
And
Except their patients are definitely cuter.
definitely.
Definitely cuter. Yeah.
And so I asked her how she did it, how she got it started. She'd been in practice, solo practice. What was she, just how it was all working out for her and if she was able to pull it off, because veterinarians notoriously, they don't have insurance to help back up your income. So they're always hounding clients for it. So I knew I was going to have insurance, so that would be helpful. But can I do this and how should I do it?
Yeah, you bring up a good point because a lot of people feel like, oh, I want to go into concierge medicine, not to knock it, but it's really hard to constantly get money from people.
It
And when you
is.
have insurance, it may not be as big as what imagining a concierge might be, but it's guaranteed.
Yes,
It's
exactly.
guaranteed, and you feel comfortable telling the patient, I need to see you in like 2 weeks to check in on you, and
Mhm.
it's not going to like
Mhm.
break their bank. So
Exactly.
I also lean into insurance based for that because I could tell my blood pressure person, listen, I'm not sure, we might need to adjust. Can I see you again in 2 weeks? Knowing that that's not going to hurt them is really important. So I love that for you. So you went into this, lots of Spanish speaking patients. You don't speak a lick of Spanish. So how long did you last in that first iteration?
So I didn't join her. I just rented space
Rented
for my
space, yes.
own practice.
Okay.
And since I'd been in practice in Flagstaff for like 20 years, I had people who were following me, even from my first practice to my second practice. So they
Amen.
were just keeping tabs because, we had good relationships. And
Of course.
so they just followed me right to my next practice.
So this is a spot you're in now?
Yes, same building. Yes.
Okay, so tell me this moment because I want to get like super granular here because it's like, well, I just went there. Like, there had to be a moment where you're like, am I really signing this lease? Like, do I have the money for this lease? Were you not scared?
Oh, yeah.
Tell us,
Oh,
tell us
totally.
that, tell us that fear. Like, because there's people listening out there who are like, should I do it? Should I not do it? Like, and then when people tell their story, like, yeah, and then I went here, and it's like, we don't talk about the terror. So tell us what it felt like.
Yeah, it is. It is. I actually ended up that I was paying a lot more than I thought I could manage. But then when made profit at 5 months in practice, I knew I could do it. I could just keep going on. And I have to say,
5 months. Okay, go ahead.
five
Tell me what you're
months.
gonna say.
So when I started in 2016, things were less expensive. Okay, they're not like
Praise.
today. I
Yeah.
I know how to stretch a dollar. I know how to keep things tight, and I recognize that that was why a lot of physicians it seemed like were going under because they did a lot of refurbing of the building. They had to have the nicest of this and that, and so
Mm.
I just did a lot of things just by stretching it and buying a used exam table and a used otoscope.
Yeah.
Yeah,
Yeah. I mean, my first exam table was a massage table.
yeah.
Like, I don't need stirrups. I'm not doing women's health. Like, so a $400 exam table compared to like a 5,000, what do I need that fancy exam table for? My patients are sitting on it, sometimes lying on it. That's it. I didn't need any of that. So I'm glad you brought that up. And buying used is also great.
And I
And I
have a
also,
lovely 1960s turquoise exam table. I
ooh,
It was sitting right next to the avocado green and the harvest gold exam table, but I chose the turquoise blue.
how did you not get the gold one? Oh my God, it's amazing. No, I mean, I love that. I think who cares where you're sitting?
Exactly.
Who cares? And my otoscopes also were used from someone who retired. So why not?
Exactly.
And I think
Exactly.
a lot of people who start feel like their very first iteration has to be perfect, and it doesn't.
No,
They're
it
coming for
doesn't.
you. They're coming from the words. I'm not saying it could be in a mess, but if it's clean, it could be small. My first place was a small little side apartment. I'm loving that you're telling your story like this way because anyone listening, like it, you can grow into the space. So like
Absolutely.
you said it's in the same building, so you were in a smaller space and then moved or what?
Yes, exactly. It was upstairs, smaller, yeah, much smaller exam rooms. And then as we've gotten more people involved, we had to move to this bigger space just 6 months ago.
Just 6 months ago? So you were in that first space for how many years?
Um, uh, 7 years.
Oh, you weren't joking about stretching that dollar.
Yep. But that was COVID too. So that was a whole new world then too, right?
Oh, that's fair. That's fair.
Yeah.
So in 5 months, you started making a profit?
Yeah, I did.
Wow. What do you attribute that to?
Well, at that point in time, EMR, I went for the free EMR that I didn't have to pay anything for because I knew physicians paid tens of thousands of dollars for that.
Yeah.
I had a biller who has worked in many aspects of healthcare, and so she was particularly good and gave me good advice on how to do things.
Nice.
Um, just buy used and make it work. And
And those patients. And how do patients hear about you? They just word of mouth, or did you do any advertising?
small town, word of mouth,
Small
absolutely.
town.
It's the best. Yeah.
Small town is
I did
great.
do some advertising, but by far and large, the things that pay off are the word of mouth in our small community.
Oh my God, I love that. There's nothing like a good reputation.
Absolutely.
So, what kept you up at night back then, and what keeps you up at night now?
Back then is, can I do this?
Yes.
And worried that, you know, I spent my whole nursing career, like 17 years as an RN, always relying on a physician and working in a facility and working for the hospital. And, those are not very conducive to saying you can do it on your own.
Oh no.
They
In
want you to
fact,
stay with the institution.
the messaging is opposite, right? The messaging
Yes,
is don't do
absolutely.
this on your own. Make sure you ask the doctor, get approval. A lot of diminished
Absolutely.
messaging.
Hmm.
So this fear, like even though in your practice before this, not your practice, in practice before this, you really didn't need the physician, there was something terrifying for like really saying, I have no one to ask.
Yes, yes. And though it is a small community and I have made my connections, but still it is it's a little scary to be out there all by yourself and depending on your own judgment. I was an adrenaline junkie. There's plenty of adrenaline in the office when the buck stops here, right?
Yes. Yes, I love that. Yeah. When the buck stops here, you're like, oh man, I hope I called this right.
Yep.
Um, and also building a really good referral network,
Yes,
right?
absolutely. Hmm.
It's like knowing that and knowing that you can, count on these people that you refer to, these specialists, to do the right thing or communicate with you. That is
Absolutely.
awesome. And how is that different than what keeps you up at night now?
Not much keeps me up at night now.
Sis, I love it. I love that. Tell me why.
This has just gotten to be very comfortable. I love my patients. Some of them I've been taking care of for my entire career. Some of them they're pushing 30 years, and so it's just a lot of fun to love my patients and take good care of them and feel their love and respect back.
Yeah, it's magical. I still
Hmm.
practice once a week, and it's just magical. The people have been around, right? It's 10 years. It's relationships.
It is relationships
It's relationships.
and getting hugs coming and going from appointments.
I'm a big hugger. I hug my patients too. I
Me
think I
too.
have as good a, like, I enjoy my interactions with them as I think more than they do. Like I really, it's a great feeling to be, it's an honor.
It's an honor. It's an honor for sure to be such an important part of their life and to share in the things that are happening with them and their family.
And the
Yeah.
trust
Hmm.
that they give to you it really is
Hmm.
an honor. I feel that way. What does it feel like you're in a small town? What does it feel like when you're out and about? Like everybody must know you.
I have to be careful what I put in my shopping cart.
Oh, because
No
people are like,
junk food.
are you getting ice cream?
Exactly.
Do
And then
they
I'll run
call you
into
out
my
on it?
then I'll run into patients and look at their shopping cart.
No way. What about if you're out to dinner and you're having a glass of wine and they're like, Mary,
Oh, usually that's not too big of a deal.
that's not too big of a deal. But you can't walk outside like looking like a mess. You always have to look on point. You can't, can you?
My
You can't run out to the post office in pajamas.
Well, this is Arizona and it is the Wild West. And we're not quite as uptight as you Easterners about how you dress and things
Okay.
like that. Now, not that I would wear my pajamas to the post office, but, I can go incognito in my jeans and my t-shirt.
Yeah, okay. Jeans and t-shirt. I don't know. I mean, you may say, I get that it's not the East, but I have a feeling about you that you're never like Too messy. I just get this. Oh my God. That's amazing. So what's your typical day like? What time do you start? What time do you end? How many patients do you have?
So when I started this practice, I had grown up on a healthy diet of the old TV show Marcus Welby MD. So my concept was to recreate it for me.
So what do you mean by that? Say more.
So I wanted to have the time to be personable with my patients and to gain their trust. And so I have 30-minute appointments for all of my appointments, 45 minutes for annual exams. I give people all the time that they need. And it's fortunate that I can start. I start at 9. I see my last patient at 4:30. I
Wow.
work part-time, and it's everything I would want. I'm very fulfilled with my patient load. Yeah.
Was it always like that part-time or did you go scale down?
No, I have always worked part-time with my practice. Yeah.
What do you do with the other part of your time?
I travel a lot.
Ooh, where do you go?
Oh, we've been to Antarctica, Africa, the
Oh my
Galapagos.
God.
Yeah, yeah.
That's amazing. So
We
you'll go out for like a week or two at a time. Obviously, you're not going to Antarctica for a weekend, and then you come back and you catch up on the patients.
exactly. And then I also do dog training. And so
Oh my God.
I do with my dog. I do agility and scent dog work and yeah, and tracking. So we have a lot of fun sports that we do, and those are weekend trialing too. So
Oh wow, that's amazing. So going back to your practice, like what is one habit or system that you've implemented that was either a game changer for your productivity or your sanity, something that really made a difference for you in the practice?
um, I'm pretty self-disciplined, and then I finish all my charts the same day.
Nice.
I don't let myself go home until they're done because I want to close the book and be done. I also have a very good biller who is also my sanity for when I'm, well, what do I do with this? How do I manage this? And so she's biller slash office manager slash friend slash advisor.
Oh my God, that's great. Is it just the two of you or is there someone else in the office too?
So in the office is a receptionist, my friend Nancy, and she's the one who can really make it happen. And yeah, so in the model that I set up is a little bit different in that there's 3 other nurse practitioners in my office, but they're all 3 in independent practice.
Hmm.
And so we all share overhead. And
Very nice.
that includes the receptionist and any equipment and obviously rent, those kinds of things.
That's really great for anyone. A lot of times the newer MP is trying to figure out how to afford space, but sharing the space is great. So then you're like on Mondays and Tuesdays, you're Wednesdays and Thursdays, like that?
Actually, we've been able to give them their own offices. And the deal that I make with them is that I'll carry the rent for a year. You put your practice together because you're going to have a lot to carry anyway. You need an electronic record. You need,
Sure.
to pay all these different things that just become yours, your insurance, those kinds of things. So I'll cover the rent for you for a year till you get your feet under you, and then you can start contributing.
Wow. So when you say their own office, like it doesn't matter what time because it's not you're not sharing the exam room. So you could
Correct.
be there concurrently.
Yes, exactly. We have actually 5 office spaces. There's 4 of us in here right now.
So office spaces mean like exam rooms?
So each of us, our office is also our exam room. So
Oh, I
it's all
see.
in one.
And the
Mhm.
waiting room is a shared space.
And the waiting room is a central shared space where our receptionist is.
So your
Yes,
reception's there, the patients wait there, then you go, you bring your person to your office slash exam room, you do the thing, and then you bring them back out, then you get the next person. So that's why it could be at the same time.
correct. Yes.
I love that.
Yeah.
So generally, is the office open like Monday through Friday then?
Monday through Thursday. We all
Monday
take
through
3-day weekends. Wink, wink.
Love that. I love that for you. And so you have that going. And do the patients get confused? Is it like under one umbrella or?
So we're not legally associated with one another. We are each our own independent practice. I think that It's the model that they use in beauty salons. It's a
That's
salon
true.
model.
That's true. In the beauty salons and the barber shops, that's true.
Exactly. Rent your station.
Rent your station.
Uh-huh.
I love that. Anyone out there who's like not sure how to do it, this is the way to do it.
It is good because then we can collaborate because we're nurses. We like to collaborate with one another. So if the new person needs someone to come look at a rash or just some advice on something, or
Yeah.
yeah, because we all have strong points.
Yeah,
So
absolutely.
that person's right there for you.
Oh my God, I love that so much. And but it seems like also like financially, it's like if they're not there, you're okay. You don't need it to stay afloat, but it helps.
Correct.
That's important
Correct.
because you don't want someone to be like, oh, I can get this super expensive place, but if somebody like leaves, they're
Right.
SOL. We don't want that.
Right.
I love that. So it's just so in the office is one staff member, the receptionist.
Correct. And we do our own vital signs and we do our own blood draws, those
Oh, I
kinds of
love
things.
that. What's one lesson that you've learned over these past 9 years that you think other NPs could benefit from?
Definitely that you can do it. It's
Yeah.
it's not as difficult as some people might make you think.
Yeah, it's so true. People make you think it's so much harder than it is. Also, you
Hmm.
just have to try. Like, you just have to go.
Hmm. Hmm.
Oh my God, that's so true.
And I think
So,
it's super important to get lots of good experience before you open your own practice,
agreed.
because you are right there. You're the person. So you got to have something under your belt first as an RN or even an NP working for somebody else. And once you get that confidence and you know what you're going to deal with, then go for it.
I agree. I agree. You need to get a little bit of something under your belt, not go straight from school. That's too much clinically.
Yes, it is.
Clinically. Yeah, I agree with you. So, one of the things that I always struggled with, especially before I had other NPs in my office when I was on my own, it's just you and you. So how do you stay updated with like the latest medical advancements and like how do you stay abreast of things?
I do a lot of reading. I read every
Hmm.
day because
Hmm.
I'm kind of obsessed about medicine. I actually really like it.
I love that.
And then the other thing is I'm president of the Northern Arizona Provider Group. And so we have monthly continuing education that we set up for under a rural health provider grant.
Oh,
And yeah, so we bring in several nurse practitioners and PAs
I love that.
monthly.
Now, one of the things that we've discovered as I travel the country with the CEO of Duet, we notice how much NPs are impacting their communities. Um, Say more about how your practice is impacting the community.
I don't really know other than I just love what I do. And my patients are happy to see me and they support me greatly in the community. And I get word of mouth referrals, so much so that I can't even take all those referrals. I have more patients. I could have more patients that I could even handle. So consequently, they get turned to the new person who's in the group.
Oh, that's great. Okay. So is
But
there a waiting list for you or?
no, I just send them to the other nurse practitioner
Okay, so
because,
you're
they
full.
want to
Your
be seen.
panel, your
My
panel's
panel's
full.
full. Yeah.
Anyone listening to Mary, don't try to be her patient. She's full.
Well, you could if you told me a good story and that you really needed me.
Give me something good. Plus, it's great you're able to grow another NP, which is wonderful. I love it so
Absolutely.
much.
And adding back to the NP community that helped me to grow.
Yeah, that's a great community to help as well. Like it doesn't have to be necessarily the community as I initially thought in my question, but the NP community having an impact, which you clearly do, is really big as well. Because not everyone has that mindset. I love that so much. If you could go back in time to maybe year one of your own practice, what's one piece of advice you would have given yourself?
It'll all turn out. Just follow you.
Ah,
It'll just follow your dreams. It will all turn out. You'll figure it out. It'll happen. Keep going.
I love it. Do you have any goals for your practice right now?
Right now, no, I'm just taking care of the people I love and I'm taking quite a few vacations because my boss really understands my biorhythms and knows how much I need vacations. And she always approves my vacation
Wow, it's
time.
amazing.
Yeah, she really gets it. Yeah.
Yeah, my boss also approves mine. It's crazy. So, although I have a feeling at this point I am not asking for as many as you do, and maybe I should up my game. Life
is short and getting shorter. Go for it.
That's so true. It's so true. All right, so switching gears here for the last last two questions. If you weren't an NP, what would you be doing?
I probably would still be doing air transport because I did love that job.
Yeah, that sounds super cool. That sounds super cool. And what's fun or surprising fact that most patients or colleagues maybe don't know about you?
I have been touched by a gorilla.
What?
We went to Uganda and Rwanda and went gorilla trekking. And one of the little 3, 4, 5-year-olds who was playing with his buddy decided that I look like a lot more fun. So he went swinging through my legs.
Oh my God. What an honor.
I haven't washed that leg since.
Yeah, I agree. As is correct. It's cellulitic and falling off, but don't wash it. Yeah. That's so funny. That is amazing. Did you get it? Did anyone get it on camera?
No, my camera was like, woo, all over the place.
Yeah. Oh my God. That is a really cool fact. That's amazing. That's amazing.
The gorillas are amazing.
Is there anything else you want to tell our audience of NPs and any part of their journey?
Just that you can do it.
I love that. Well, you heard it here.
I think the other important message that I want to deliver to NPs is that physicians have elected to vacate the family practice, independent practice, and they've moved to the hospital. And I think we need to get in here right now and fill this spot before they come back, because it is a beautiful spot to be, and self-determined, and you manage your own practice and you do what's right for you. So let's get in there and take hold of it and keep it for us.
Oh my God, I could not agree more. This is like the ultimate time, which is another reason why I love working with Duet, because they see it too. And they're like helping NPs in every size and every part of the journey to be able to survive. But I couldn't agree with, like, this is our time. Like,
yes,
hurry up and grab it.
Hurry up and grab it, because if we don't take it right now, it might be gone. So and do a really good job. We're nurses. We've been talking to people a really long time, even before we came NPs. And we know how to talk to people. So let's use our skills where it's really needed. And that's at the family practice level.
Yes. Amen. I love that so much. Oh my goodness. Mary, thank you for your time.
Thank you.
I know everyone enjoyed this one. You did it great for your first podcast. You were a natural.
Thank you so much. You made it easy. So,
Thank you. That's so kind. I look forward to talking to you in all our other adventures.
I do too.
Have a good one.
Take care. Bye-bye.
Bye-bye. Well, that's wrap for today's episode of Unsung. If this inspired you, share it with another NP who needs to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. If you want to join the largest NP practice network, learn more about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.